Hi, this is Ross Miller from Sonitus Medical giving a presentation on impressions for the dental assisting staff. Now, we in dentistry know how critical the dental assisting staff is to our offices, and this presentation is for you because you're critical in making the SoundBite work for the dental patients that you see. The topics I want to talk about today are the impression technique, the model, and then we'll summarize. First of all, you are taking an impression of a prosthetic hearing device that goes in the mouth. We call it an intraoral hearing prosthetic. And what it does is send slight vibrations through the teeth so that a patient can hear better. So this is the first time in dentistry that we can help our patients hear better. It's for people with single-sided deafness at this point in time, although it might be used for other things. It requires an accurate impression of both soft and hard tissue. The SoundBite impression is different than other impressions because we require the palate, the buccal soft tissue, and the distal. We actually require probably more distal than most devices that go back in the mouth. So we call it a SoundBite impression, and it can be either quadrant or full arch, and we prefer alginate. The alginate I use is Chromopan 100. Even though it says 100, I try to pour it up as soon as I can. That's 100 hours. I'm not sure there's an alginate out there that doesn't change a little bit. I like the stuff. Works great. Great product. I use also the Dux Alginator 2. This helps me mix it better, and I get that from Pearson Dental. But you can use anything you have in the office. I mean, that being said, this is what I use, but you can use any alginate. You can hand mix. You can do what you like to do normally. One thing that does help a lot if you're taking quadrant trays is actually this swivel tray by Co. It's the number 99 swivel tray. It works for left and right. And the nice thing about it is you don't have to worry about whether you have a left or right tray in the office. You don't even have to worry if you have an upper or lower. It works for everything quadrant-wise. And you'll see that we take probably more than a quadrant. We probably take a 3/4 full arch tray impression. But this is a great tray to have in the office. A couple of good and bad impressions. Here's a really good impression with a quadrant tray. Notice that I got the front two incisors in the impression. It goes almost straight back along the palate. We've got several millimeters behind the last distal tooth, and that's what you need to do. You need to get several millimeters behind the last distal tooth, be it a first molar, second molar, or third molar. A not so good impression is one that's missing palatal information. We need this information for our device, and if you take a look at what our device, let me go back here, you'll see that we need the information on the palate, and we need all the information near those the last 3 or 4 teeth in order to make this device, make the ITM. We call it in the mouth. It's one of the components of the SoundBite hearing system. So not so good impression. We've already seen that. And then here's a good upper impression. It's kind of not as on the right. It's not as good as it is on the patient's left. A nice thick roll over here. But this is what we see sometimes with full arch impressions. You kind of get a roll back here. One side's usually good, but the other side's not so good. Now I'm sure some of you guys can take better impressions than I do, but we really need that thick vestibular impression to do a nice pour up. So our lab is very particular on these, so we need to get those, get them what they need to make this device fit. It's not a hard impression; it's just a little bit different. So more specifically, ensure that the model includes accurate dental and soft tissue anatomy extending to within 2 to 3 millimeters of the midline of the palate, 2 to 3 millimeters past the gingiva on the buccal side. That is, it needs to come up into the vestibule, and 2 to 3 millimeters past the last molar on the distal side. So you need to come past, go past the distal molar. Be it this is a second molar, but if it's a third molar, you got to come back behind that. And a lot of times with third molar cases, you don't have that much tissue back there, not that much room. Alginate material should be used to take the impression from which the model is made, because alginate more accurately captures soft tissue without compression than PBS due to the better flow characteristics. Alginate can push the tissue away and flow into that area without making too many knife edges. Please don't send impressions. Always send the casts. Avoid using single crown impression trays, especially like just little quadrant plastic trays. Those don't work very well. And remember, this is a different type of impression. This is a SoundBite impression. You're making a patient a prosthetic hearing aid or hearing device that goes into the mouth. Before taking the impression, take a look at the dental anatomy, trying the tray, noting where the front edge of the tray is so you can duplicate the position when the alginate is placed. Put excess alginate on the palate before taking the impression. You can also put excess alginate on the lingual side of the impression tray. Take the impression, make sure it's seated and not moving, remove and pour up as soon as possible. The actual technique, I'm going to show it to you on this nice little patient that doesn't have any saliva. My little type it on here. Trial fit the tray, that's very important. Again, try that in. Again, we use chromopan and alginate in the office. Just a series of photos. This is what, looking down into the container of alginate. It's, your typical powder. We have a water scoop and a powder scoop. I use 2 powder scoops into the bowl. Add some water, 2 scoops of water, and then I mix. And you can see with the rotating, this alginate just rotates that bowl. This alginator rotates that bowl, and you can get a very nice mix. And you notice that when you're mixing, the chromopan is purple, and then it turns to pink when you're ready to put it in the patient's mouth. And I usually have a little bit of a excess material on the lingual side, the palatal side of the impression tray. And then I leave a little excess here so I can put that on my finger. Take that, put it in the mouth, and then take your impression of that side. Notice that you're basically getting 2/3 or 3/4 of the upper arch. I mean, you can go ahead and take a full arch if you like. I prefer to do this because I can get all that material back behind this tooth back here, the distal tooth. And my assistant takes a lot of these. I take them. We probably a 50-50 split. We both got pretty good at this over the last few years working with the SoundBite system by Sonitus Medical. Here's an impression off of there. Close up, you can see that we got pretty good definition around those teeth. This is sort of a artifact based on, they just grind this, type it on off here. And then you can see I could have done a little bit better here and here. But not bad. This is usable because we've got all this information on the palate. Okay, that's critical for where we put our device. Some challenges that you might face, and you will face. I mean, if you see a lot of patients, you see the tori's in the mouth. We need to get material around the tori's on every patient that has a tori. We need to get that up in the palate. You don't want to miss that because otherwise it's guesswork on our laboratory side. Sometimes it's orthodontic issues, in and outs. Maybe the right side of the patient would be better than the left side on this particular patient. Missing teeth, unfinished dentistry, that can be a problem. Sometimes you want to get that dentistry done before you take the impression or get them into SoundBite. And then the occlusion. A lot of times a lower arch, you can have a crossbite where, looking over here, if this patient has a crossbite, they may hit this part of our device. And this device, this needs to be kind of in a peaceful situation in the occlusion. It can't be chewed on. This whole device is out of the occlusion. We try to keep it in between the tongue and the palate and the cheek and the teeth. So it's completely out of occlusion, and they shouldn't be hitting that. Just a few schematics on how the bite could affect your impression taking technique. We put a tube in the back on the distal side of the last upper molar. It's a .061 hypotube. What is a hypotube? Well, it's a fancy way of saying that there's an emptiness inside of it and there's electronics in there. So it looks like a stainless steel wire, but it's actually a tube with electronic components running from the battery on this side, on the palatal side, over to the actuator on the buccal side. So in this particular configuration, there's no reason why you can't take. If there's no crossbite, nothing going on the upper, no tori, everything's clean. Go ahead and take a quadrant. You're not going to have any problem with a quadrant tray. Where you might have problems with a quadrant tray or is the way the bite comes together. And you can actually take 2 quadrants or an upper and lower full arch. But you can see if the lower teeth are going to hit back here, like if you've got a class 2 situation or where the patient's got more teeth on the lower arch than the upper teeth, if the gums come way up here, we're not going to have much space for that hypotube, and it might hit the lower teeth. So options there are a gingivectomy up here of some sort and move it up, or move it back. You try to get it out of that occlusion, and maybe it might be a little bit less comfortable there. So you need to take an upper and lower impression in that particular situation. Here's a situation where you have thick gums in the distal area of a second molar, probably because a wisdom tooth's been taken out. Might impact, the lower tooth might impact there. Here you could do a gingivectomy, laser surgery, or electrosurgery, or whatever you want to do. But take a lower impression, upper impression, and patients keep their mouth open. I mean, 99% of the day, 97% of the day, teeth are apart. This is a limitation of our product. I mean, remember, we're balancing this against a surgical procedure, and this is a reversible procedure, but it has, it goes in the mouth which no other hearing products do. Some good models. Here's a great model. Lots of impression, a lot of palate impression, lots or data, lots of good information on the lingual side or distal and buccal side. Here's a case where this is a PVS impression. We get some knife edges. We see some great information from the light body of the crowns, but that doesn't help us if we can't see up here and have to grind this away and then get data that get some information that's not that useful. Some other impressions, and I'm actually thinking some of these there might be duplicates, but great. Pour up, pour up, pour up, pour up. Okay, just focus on the fact that look how much information we have distal to that second molar and the palate, and those are good to go. Here's another PVS impression that we got in. Now that light body doesn't flow. You need, if you're going to do PVS, which you'd rather not do, you got to make sure that your heavy body gets as far out on that palate as possible and as far up here as possible before you do your wash. This is not going to help us. We don't know if there's a tori in there. We don't know anything about what's happening here. So this would be something that we wouldn't want to have. So watch out for that. What kind of stone do we like? Well, we like the dental stone by ETI Empire Direct. That's what we use internally. Works great for making devices. Again, you can use whatever stone you like, but this is what we prefer, the dental stone high strength. Try not to adjust your models. Remember, this is taken for a crown model. And what we're doing is not a crown, so we definitely need the information that would have been here had it not been removed. And also true here. Don't remove information from the cast. Send us a cast as it's poured up from your office, not adjusted. This is what the actual ITM looks like. ITM again stands for in the mouth, and it links electronically to the BTE, which stands for behind the ear, and I'm not going to get into that here. You can go to our website at Sonitus Medical for more information on this product. And the BTE communicates with the ITM, but this is what the ITM looks like. And ITM is simply in the mouth. Our actuator is on the tooth, on the buccal side. The nub is the only part of it that should be touching the teeth. And then we have a battery over here. We have acrylic material here for retention of the device. And the hypotube that brings information from, you can see two little wires there. They go through that tube and come over here. So it's a very interesting device, and it's the first of its kind for helping your patients hear using a dental platform. In summary, it's a SoundBite impression. It's different than a crown impression. Now you can take a quadrant, a full arch, you can take whatever you like to take in your office. We need the data, we need information on the palate, on the distal of the teeth, and on the buccal of the last 4 teeth in the mouth. Identify potential problem areas before the impression, identify any occlusal problems, any sort of soft tissue problems, hard tissue problems before you take an impression. A crossbite, high gingival, distal of the upper teeth, or posterior crossbites may require you to take a lower impression. And also you may find yourself in a situation where you might want to take a full arch impression. Pour up the model. Do not adjust the model. It's a great way to help our patients hear better. And it's the first time I think in dentistry that we're in a position that we can help our patients hear better. And it's a very exciting time. And I hope that you enjoy working with SoundBite. Go to our website. Again, just go ahead and Google Sonitus Medical. And we also have a site called www.soundbitehearing.com. Both of those have valuable information on our product And good luck with taking these impressions. It's not hard. It's just little bit different than a crown impression. And have fun doing it. Thanks.